Prime Minister, in addition to the elective surgery that you're going to be reviewing, might you also include IVF procedures? Obviously, that's been a concern for parents who have been told, well, prospective parents have been told they can't do that. And if I may, a technical question for Professor Murphy. About a week ago, you started publishing recovery data. Do we actually have a nationally standardised way of determining when a person is considered recovered? Is that being applied by every state and territory?
I'll let Brendan deal with both of them, actually, because that was the intention.
Yeah, so I think IVF is definitely something that would be considered an elective procedure and something that was paused during the elective surgery cessation, and it's something that the state and territory health departments will be considering along with the other range of elective activities. It's very important if we do restart elective activity that we only do it within the confines of our available PPE supplies. So it would have to be fairly gentle because we have to ensure that we have enough protective equipment. So that modelling is being done at the moment. At the moment, recovery, we have stopped doing clearance testing after people have recovered. So a recovery, people are allowed out of isolation 2 weeks after diagnosis if they've been completely symptom-free for 72 hours. And we are making an assumption in our modelling that people who are released from isolation are now recovered. There's no longer, unless you're a healthcare worker, in some states we're doing tests to make sure that you're not still carrying the virus. So we are working towards a nationally consistent algorithm to determine recovery at the moment.
I'll go to Brett and then...
Yeah, you sort of opened today by saying that the states and territories agreed that there's a need to synchronise the health and economic response. There will still be a lot of parents tonight who won't know whether they should send their children to school. Are you frustrated that there isn't that synchronisation in terms of education? And to both of you, the big announcement today in terms of Aboriginal and Torres Strait Islander communities, testing and care. Can you perhaps elaborate on just how important that is in those communities where you've said before you've been most worried about COVID-19 taking hold?
I'll let Brendan deal with the second part of that. On the first part of it, I wouldn't agree with your assessment of how I would feel about it. The principles, I think, do set out very clearly what we all agree and what we're all sort of working towards. I mean, parents should follow the instructions that are being provided by their state premiers and their state education ministers and for the arrangements putting in place. See, if you're going to school in Victoria, there's only one person you need to listen to, and that is the Premier of Victoria, as to what you should be doing in Victoria. Likewise, in New South Wales, you should listen to what the Premier of New South Wales. You don't get the choice to go to school in Victoria one day and New South Wales the other, even if you live in Albury-Wodonga. But if you're looking in the Northern Territory, then it's what the Chief Minister there is saying, and they have their arrangements which are different again. I mean, we're a big enough country with very different geographic and different case scenarios that are occurring in our states and territories for there to be some differences. But those differences, I think, all accord with the principles that we've set out today. So I think it's very clear that the medical expert advice is children are safe to go to school, but there are issues within each state about the delivery of education which they have had to take into account, which means that they will be operating on slightly different bases, but I think consistent with these principles.